Let us use the skills we gained previously on how to search for medical literature by searching for vitamin B12 absorption and pernicious anemia. Regarding this topic, we want to answer 3 clinical questions. How is vitamin B12 absorbed? Which are the main causes of vitamin B12 deficiency? And how does vitamin B12 deficiency relate to pernicious anemia? Apply your searching skills to retrieve the best available literature on this topic using PubMed. Remember to use the appropriate keywords, mesh terms, and filters. Visit PubMed and under More Resources, choose the mesh database. Search for vitamin B12 deficiency. Select the appropriate subheadings, diagnosis, and therapy, and add it to the search builder. Look for pernicious anemia. Add it to the search builder with the same subheadings. Click Search PubMed. Now apply the appropriate filters. First, limit to studies concerning humans. Then, to limit to articles in English, choose Show Additional Filters and click on the box by languages. Then click on the Show button. Select English. We are selecting reviews to get a feel for what is out there, and the information in reviews tend to be synthesized and easier to read. I recommend searching for systematic reviews, randomized controlled trials or RTCs, and clinical trials also. To do this, click on Customize and choose Filters, Clinical Trials, Randomized Controlled Trial, and Systematic Reviews. If searching for systematic reviews, I recommend using the Cochrane library database available through the medical library. Scanning through the results, we can select based on title some potential relevant articles. Let's look at Clinical Practice, Vitamin B12 Deficiency. To determine the relevance of the article, you must be able to answer the clinical questions you set to answer from the clinical scenario. 1. How is vitamin B12 absorbed? 2. Which are the main causes of vitamin B12 deficiency? 3. How does vitamin B12 deficiency relate to pernicious anemia? If you can answer these questions by reading the article, you can determine that it is relevant. Now let us determine if the article is valid. There are various ways to go about doing this. The best and most accurate way to determine validity of a study is to examine the internal and external validity. Internal validity refers to how well the research was done, if proper measurement tools were used, or the researcher avoided confounding variables and bias. External validity refers to replicability. Can the study be replicated and get the same results? For this, you must have a good understanding of research methodologies, including was the study design appropriate for the research question, were the tools used to assess or measure association appropriate, were the statistical models used appropriate for the data, and so on. Please view the videos listed on the YouTube summary area for more information on internal and external validity and using the Cochrane library database. Another way to evaluate the validity of a study is to look at the content of the article for deficiencies or errors. Once you get the full text version of the article, let's look at the key sections of the article that will give you good indications of the quality of the article in terms of content. The references represent how extensive and well executed the literature searches were done. It is not so much the quantity, but the quality of the references. Are they coming from reputable journals? Is there a good representation of the history of the topic? Recent and older articles included. This really depends on the article. If the topic is time sensitive, like looking for the newest treatment intervention, then the article should be recent rather than old, unless nothing new has been created recently. We have 52 references, and browsing through them, we can see that a good variety of related topics were covered, and most of them are relatively recent. This article contains a case vignette that highlights a clinical problem. A clinical scenario is presented and key background information is presented. You can find information regarding pathophysiology and causes of vitamin B12 deficiency very early in the article. The author covers the basics of vitamin B12 deficiency and potential causes. By reading the article, you can answer all three clinical questions. How is vitamin B12 absorbed? This is answered in the first section of the article, the clinical problem. Which are the main causes of vitamin B12 deficiency? You can find the answer in the subsection, causes of vitamin B12 deficiencies. How vitamin B12 deficiency relates to pernicious anemia can be answered in the subsection, pernicious anemia. According to our findings, we can decide that this article is relevant and valid since the article answers our clinical questions and is coming from a reputable source, the New England Journal of Medicine. And the author presented a quality and thorough literature search, and the information presented is well organized and properly cited. Keep in mind when conducting research and assessing for relevance and validity, look for clinical trials and randomized controlled trial articles. Internal validity, can you identify any strengths and/or weaknesses based on the study design, statistical analysis interpretation, and the conclusions of the author or authors? External validity, can the finding be easily generalized to the intended population?